Wonderful. Good evening, everyone. My name is Irina MacArthur. I'm Director of Patient Experience at Inception Fertility, and I'm truly grateful uh, to have you here with us tonight. Today's webinar focuses on sexual well-being during infertility treatment and the entire journey. It's important, but often unspoken part of the fertility journey. While infertility is usually discussed medically, it can deeply affect intimacy and relationship and emotional connections in a couple. And our goal tonight is to provide a supportive space to better understand these challenges and how couples can stay connected throughout the treatment. We're honored to have Dr. Dali Ali Domar and Dr. Elizabeth Grail leading tonight's discussion and bringing the expertise in the emotional and psychological aspects of fertility journey. We'll have some time for Q&A, so please feel free to submit your questions through Q&A box, or alternatively, and this is preferred way for us, please raise your virtual hand. I will unmute you and you can ask your question live. Thank you once again for being here tonight, and I will turn over to our speakers.
Thank you. Al, you want me to jump in?
Oh, I can sorry. I'm sorry. I kept on getting bounced out. Did Arena already introduce us?
She did. She did a beautiful introduction of what we're talking about tonight.
Sorry, guys. I'm a little punchy.
That's
I've been
okay.
stranded in Florida for the last couple of days because of the snowstorm up here in Boston and New York, and I'm a little punchy. Um, it's my distinct pleasure to introduce what I call my work wife, because Liz and I spend so much time working together. I think I spend more time working with her often than seeing my husband. Anyway, and she is a certified sex therapist, and our patients are constantly asking about their sex life. And I figured rather than me making up something, it would make way more sense to have Dr. Grell come and talk about infertility and intimacy and sexuality and how to get it back. So without further ado, Dr. Grell.
Perfect. Thanks. It's always fun to do stuff with Allie. Like she said, we've done so many projects together. So glad she made it back today on her delayed flight. Um, yeah, just a little bit more about myself. So I am the Director of Psychological Services at Weill Cornell Medicine in New York. And I am a professor there as well. I've been there for 25 years, so this has been my life's work really. And as a postdoc, I did a sexual health postdoc pretty shortly after I started in the infertility space because what I realized was so many people had issues for obvious reasons that we'll discuss with their sex lives. And I knew to ask the questions, I just didn't know how to help them afterwards. So I went and I got the training that I needed to be able to do that. And I've been doing it ever since and spreading the gospel about how important it is for us to be talking about this. And yeah, so we can jump right in. These are my disclosures. So I always start with level setting about the emotional distress that patients feel. We have our expert here, Dr. Domar, who published probably one of the first and best studies that's quoted over and over again about the fact that the distress levels of people going through the IVF process are comparable to those who are experiencing or diagnosed with a terminal illness. So, and on the right side, you can see on the life event scale, the failure of IVF is rated equal to breast cancer, death of a family member, and worse than divorce. The reason why this is important is that people feel like they're going crazy, right, as they go through this. And that is not what we want people to be experiencing. So just to validate, I'm preaching to the choir a bit, but to validate the immense emotional turmoil that people experience as they go through this, it's real and it's normal. Go on to the next one. This is just a short list, unfortunately, of part of that crisis that people experience. There's so much loss that people go through. I don't think that it's talked about often enough in terms of grief and loss, but that really is what the experience is for patients. And here you can see some of those things, a loss of the fulfillment of a family, of relationships, of a sense of self-esteem, masculinity, sexuality, security. And the last one, loss of perceived control, I think is really the most paramount one that people experience. We like to be in control as human beings. We are used to using coping strategies like studying hard and getting a good grade on a test, or, preparing for an interview and getting a job. And when we approach the family building piece with any kind of challenge, it really wreaks havoc on what we expect in terms of being able to control our lives. So we can take all of our medication the way we're supposed to. We listen to what the doctors tell us. We do everything right. And still, it may not happen in the timing or in the way that we thought it would happen to become a parent. And I think that that's a really hard lesson for people to learn as they go through this. Next slide, please. And Allie, feel free to jump in. I mean, I'm just kind of running through this, but we can wait to the end if you want. But I feel free to interrupt if you have things you want to say.
Yeah, oh,
Um,
I'm really good at interrupting.
I know you are, but just wanted to remind you you should do it.
I
Uh,
come from a long line of interrupters. I'm married to an interrupter.
So jump in. Um, Reproductive medicine triggers. So I just started adding this slide to my talks because I think it's so important to talk about triggers. Triggers is a word that I think is overused a lot. So to give you a sense of what it really means, if you're experiencing something and you're sort of having a very strong reaction to it, maybe stronger than you expected to have, it could be triggering things that have happened in the past. So any kind of trauma, and that could really be any kind of pregnancy loss, any kind of loss of a loved one, any kind of more significant trauma that you experienced growing up, any kind of medical trauma, surgeries, medical problems that you've had, really anything. And so the important thing to talk about is that going through IVF can trigger a lot of that. Right, the procedures, the discussions, these are personal discussions. Men are asked to masturbate in a cup and leave a sample. Women and men are getting STIs, discovery of any kind of infertility related to past STIs, of course, pregnancy loss, prior terminations or abortions, any kind of history of reproductive trauma, and then all of the emergencies that can happen along the way. There's a lot of hurry up and wait. There's a lot of unexpected situations that pop up during this process. And then Allie and I see a ton of people for needle phobias, right? You didn't go to med school, you didn't go to nursing school. The thought of having to inject yourself is so foreign to some people that in and of itself could be the most stressful thing anyone would have to go through in their lives. And it's often not even talked about. It's just sort of like, yeah, so you'll do some injections, you'll get pregnant, right? But it's a pretty serious thing and it could create a lot of anxiety for people. All right, next slide. Okay, so we'll talk about sex because that's what we're here to talk about. Why are we talking about this? Why is this important? Well, procreation tied to sex, right? So it's something that's going to come up. It makes people very uncomfortable often to talk about it with professionals and with each other. But 40 to 60% of people are experiencing sexual problems as they're going through this. Silence is only going to make it worse. You have to break the silence. You have to know this is normal, that when you're going through this, you're going to be trying naturally at first on your own, most likely, unless you're going straight to reproductive medicine for other reasons. And that experience of trying on your own, whether it's a couple of weeks or 6 months or a year or longer, is going to wreak havoc on intimacy, sensuality, sexual self-esteem, your experience of your own body, your experience of your partner's body, and the intimacy between the two of you. Go ahead to the next one. So why does this happen? Because we're shifting sexual meanings, right? Sex for pleasure and connection and fun, it becomes sex for procreation. Sex as an expression of intimacy becomes about work, right? Planning, methodical. When am I ovulating? When is my partner going to be here when I'm ovulating? And then sex as an expression of love becomes sex as an expression of failure, unfortunately. It can be linked to pain. It can be linked to the experience of not getting pregnant and losing a pregnancy. And so all the associations of what once used to be kind of closeness and warmth and intimacy can be a reminder of what you don't have and a reminder of feeling like a failure. Next slide. And here you see why that is, right? On the left-hand side, you have all these sexual feelings, right? Warmth, affection, spontaneity, adventure, tenderness, pleasure, emotional connection, fun, which is an exact opposite to everything that people begin to feel as they go through infertility, which can be linked to loss and anger and guilt and despair and depression and shame and anxiety and failure. And when you look at that list, the last thing you're thinking about is intimacy and sex, right? And so it's just to sort of put it out there that this is pretty normal, that the feelings that we normally associate with sexual feelings are not in alignment with what we experience as people are going through these challenges of infertility. Next
Well,
slide.
let alone the fact that sexual feelings, sex can feel really good, and infertility treatment can feel really bad.
Mm-hmm.
And I mean physically,
Triggering
not just
pain.
emotionally.
Yeah, absolutely. So the common problems that we start to see is this kind of routine-based sex or avoidance of sex. I have a lot of patients will start to say, you know, right when I'm ovulating, all of a sudden my partner has to stay late at work, or a business trip happens the week I'm ovulating and he's going to be gone the whole week. And so oftentimes people will begin to actually avoid the act of sex, which can be infuriating and impact problems even further. As we were talking about, sex can be tied to a sense of failure and pain, emotional and physical pain. Sex on demand and performance anxiety is a real problem, right? So a woman could be waiting for her, ovulation, right? She pees on the stick. She's like, oh, tonight's the night. She's not feeling any desire. She's not feeling any arousal, right? That she has to sort of get herself into a place where she can do this because it's so important. Well, the partner also knows it's very important. And so suddenly there's all this pressure to perform. We have to get this right in the next 24 hours. And suddenly he can't perform. He can't maintain an erection. He may have ejaculation problems, which we'll talk about as being very common. And so then the resentment builds. And the worst thing I hear, but we hear it often, is this blame game, right? Sometimes you'll have the woman say, my God, he only has one job. I'm injecting myself every day. I have to do all the, he has one job. He has to get an erection and masturbate in a cup and leave his sample, right? And he can't even get that right. So very emasculating for men, very demeaning. These problems start to happen with very little empathy, between couples. And then there's a real breakdown in communication. Next slide. This is really important, and I will say not just for IVF and infertility, but in general, these myths are so damaging, but they exist, right? There's this sense that women must always be responsive, like ready to go with arousal and desire whenever their partner wants them. Men are always ready to perform, no problems, right? They can get an erection anytime they need to. Not true. And desire should just be automatic. We shouldn't have to work at desire and arousal. We shouldn't have to work at romance. These things should just be spontaneous. And even in couples who've been together a long time, after the honeymoon phase is over, after they've been together for a year or more without any kind of reproductive issues, these things actually become a real problem in the sex therapy work that I do, where we have to really kind of bust these myths as not being true or accurate at all. Next slide. So what are the typical male problems? You see a lot of erectile dysfunction. Up to 30% of people are reporting mild to moderate forms of erectile dysfunction, and then ejaculatory disorders 2 to 3 times higher. And that can go either way. So this can be premature ejaculation. So men become so used to needing to kind of fulfill this, work-related thing they have to do so quickly that it becomes habituated way to be sexually. And so even after the reproductive issues are done and they have their families, sometimes they find that they have premature ejaculation that lasts longer because they've become so used to having to kind of like get the job done as quickly as they can. They have this one job to do and they have to do it efficiently. And the
Hey,
other,
Liz, can I just interrupt for a
yeah,
second? Can you give the definitions of those three things?
which are erectile dysfunction,
Dysfunction,
right?
ejaculatory disorders, and premature
Yeah,
ejaculation.
yeah. So erectile dysfunction is the inability to maintain an erection, right? To either maintain or sustain one, to get one, and then maintain one long enough to be able to have penetrative sex and be able to ejaculate. Ejaculation disorders is what I was describing, can be premature ejaculation or delayed ejaculation, right? And either one of these can be a significant problem when we're talking about fertility. Maybe not the premature ejaculation in terms of pregnancy and trying to conceive on your own or trying to leave a sample in a cup, let's say, but long-standing issues that can become a real issue later on if it doesn't go away. I should say if it's a problem for people, right? Some people are like, it's fine, I have satisfactory sex. If I ejaculate within 2 or 3 minutes, not a big deal. But for some people, it can cause distress. Delayed ejaculation, on the other hand, or inability to ejaculate also happens because men can get really nervous about this performance they have to do. They know the stakes are so high and they know that this is the one job their partner told them they have and they have to get it right. And sometimes that prevents their ability for the body to work properly, right? To relax enough to be able to ejaculate, right? And so that can be a lot of pressure on men as well. So those are the most common things that we see happen with men. Next slide. and with women as well. So 40% of women experience some sort of sexual dysfunction, which is quite high. And this is across all of the aspects of the sexual realm of functioning. So we call that arousal, orgasm, and desire. All of these things are affected. Sometimes there can be genital pelvic pain disorder. That's the sort of the DSM clinical diagnosis, but that's any kind of pain a woman is experiencing. In the old diagnostic terms, it used to be called like vaginismus or dyspareunia. So, painful sex, or the vaginal walls can have these spasms, which don't even allow for penetration to take place. And that's something that we can treat as well. On delay or absence of orgasm, again, like women are trying to be just as efficient as the men. Like, let's just get in there, get the job done, be done with this, do what we need to do. And so there's not a whole lot of concentration anymore of satisfaction of partners, foreplay, exploring each other, closeness, that sense of like safety and spontaneity. That goes out the window. So it's about like, okay, I'm ovulating. We need to get this done. How are we going to make this happen?
So Liz, when I first got into the field, there was a myth that a woman was more likely to get pregnant if she had an orgasm. Is that true?
Yeah, no, that's been debunked.
Okay.
Yeah, yeah. I know we could
Men
probably do a
do
whole talk
because
on
they have to
myths.
ejaculate, but women
Right.
don't.
Yeah, right. There could be a whole thing we could do on the myths of like the pregnancy, right? Keep your legs up in the air. If you orgasm, it's it. Yeah. And all, of course, sort of like, what the woman has to do. But the men suffer quite a bit as they go through this too. All right, next slide. So the impact on the relationship on what we've talked about, it's pretty significant. You're going to have across the board a reduction in sexual desire, ability to function, overall sense of sexuality. That emotional distancing and blame is a real problem. So people begin to say, well, it's your fault you didn't come home on time while I was ovulating, or you scheduled your business trip, or you couldn't get your erection and you couldn't penetrate, or you couldn't leave a sample. And this is really difficult for men, right? Because they often have to like go into this cold, sterile environment. And again, the myth, like they're expected to just perform at will whenever they need to. And a lot of men can't do it. Communication breakdowns. No one wants to talk about this. It's easier just to throw blame around, and that really kind of creates this chasm where people start to kind of split apart. Next slide. So what are we going to do with all of this mess that people tend not to talk about? So we want to rebuild connection, right? You're on the same team. This blame game is not going to work. It's not going to, it doesn't get either partner to the finish line, right? It's not getting you where you want to go by saying it's your partner's fault. And that, of course, includes things not just in sexual performance realm, but like we waited too long. It was your fault. You weren't ready to have kids. I wanted to get married earlier. Like we see the blame game go all over the place when it comes to couples who are doing this. Compassion and empathy is really the key here, right? If both people can understand the sexual stress, which often no one's talking about at all, it can really have a huge impact. If you're able to turn to your partner and say, hey, look, I know that it's really hard to maintain an erection when you're so stressed out because I'm putting all this pressure on you and we have like a short amount of time to make this work. What can I do to help you? What can I help to, build in more relaxation or more connection? Oftentimes there's this other myth that men don't need the same level of connection, right? They're just ready to go, but that's not true. What can I do to help you feel safe? Um, and the other way around too with the woman, there's a lot of pressure on sometimes, you see women who are not wanting to tell then their partner that they're ovulating that night because then it's too obvious and it puts too much performance. But then they're calling their partner, 10 times that day. When are you coming home? Are you going to be home on time? What time do you think you're going to meet? You don't have any meetings scheduled, do you? And then the guy shows up and she's in like full lingerie for head to toe, even though she's not feeling sexy or feeling in the mood at all. And so, partners know, they're also monitoring ovulation. And so it's just better to talk about this stuff and figure out the likes and dislikes and what's needed and what's working and what's not working. Flirting can be great, renewing affection. And remember, flirting is not like if you're going to start sending your partner cute little texts during the day, like, I love you, you looked great this morning, I miss you, I can't wait to see you when I get home tonight, I'm going to bring home a special dinner. That's not sexting, right? So there's a big difference. And sometimes couples get it wrong and it doesn't go over well, right? When I say like flirting, this is just like what you used to do when you first met. Leave a little sticky on the mirror so that your partner sees it when, she wakes up before she goes to work or he goes to work. Enjoy the activities brainstorm activities. What did we used to do when we were dating? What did we love to do? And be like, oh, that great restaurant we used to go to on the corner. We should see if that's still open or we should order from that place we used to love. These types of things can kind of invigorate a relationship that is feeling very tense and with a lot of divide and a lot of distance. So it can start to kind of renew that kind of connection again. Next slide. Create fertility-free zones. This is really important when you're forced to take a break or you choose to take a break, right? If you can do that. Some people go back to back and sometimes clinics shut down and you're able to say like, okay, let's take a mental health break. Let's use this time together. Create sex zones that are free from reproductive zones. What does that mean? Maybe the bedroom is a place that you have procreative sex, but maybe the couch is a place that you have connected kind of intimacy, spontaneity sex that has nothing to do with procreation. You're not ovulating, you're not even trying to have sex. I mean, trying to get pregnant during that time. So really setting aside these times can open up space again to explore each other in a way outside of reproductive intentions, and that can really, really help.
Okay, can I just tell a funny story here?
Yes, please.
So this is years and years ago. I was on the Today Show during a segment to sort of how to bring back, the fun and sex while you're going through infertility. And so they sort of prep you ahead of time what you're going to say. And I was telling them, yeah, I was going to say, have sex in different places, like try having sex on the kitchen table. And the producer like turns blue. It is like, you cannot say on the Today Show, have sex on the kitchen table. Then she said to me, it might be kind of fun to have sex on the kitchen table.
But we can say it here.
You can say it here. Yeah. But
Yeah.
yeah, do wild and crazy things. Have sex in the shower, have sex on the bathroom counter, you know, live a little.
Yeah. And if you designate those spaces as separate psychologically, it really does help, right? Like you have this one zone of your apartment or your house that is really where the procreation piece takes place. We know we're going to be monitoring ovulation. We know that there's a task at hand that we both need to accomplish. But outside of that, it opens up those spaces again where you can sort of have that feeling you had before you started to have children. All right, next slide.
I still like the kitchen table.
Kitchen table's good. And then maybe make sex fun again. I put the maybe in there. I don't want there to be any pressure on people. For some people, they just have to back away from sex for a while and that penetrative sex for a while, and that's fine. And I use that, and I'll explain why in the next slide. But plan playful sex dates, try novelty, go to a sex shop together, order some stuff online. It's so easy now for stuff to be delivered to your house. Use humor and exploration. The nice thing is when you get to a place where you're building a family, you've probably been together for some sense of time, right? Some people start sooner than others as after they meet. But the nice thing is that with that comes more intimacy and safety and security in the relationship. And that can open up space for more humor and exploration and fun. And so again, use those non-procreative spaces to try some of these things. All right, next slide. So this is what I was talking about before. Intimacy isn't only sex, and it's not only penetrative sex. And there's a real myth that people grow up with that there's only one way to have sex, and it's with penis, vagina penetration. I'm sure you couldn't say that on today's show either. But that is not the only way that people can have sex, right? And so it's about touch, it's about pleasure, it's about joy, it's about cuddling, it's about massage. Pressure-free closeness is so important. I can't begin to tell you how much I have couples say, well, I used to love to snuggle up under a blanket and watch a movie, or, sometimes I look at you when you come home from work and I just want to wrap my arms around you and jump in your arms and give you a big squeeze and kiss. And I'm like, so why aren't you doing that if the intention is there and the desire is there? And the answer is always, almost the same, which is I don't want it to lead to sex, right? So if you contract with each other, and it's so sad because both partners are craving that touch and that intimacy, and they're avoiding it because they don't want it to turn into performance anxiety and sex and penetrative sex. So if you guys just have a conversation about it and be like, I want to hug you every day. I want to kiss you. I want to cuddle with you under the couch. I want to touch you. I want to do everything but penetrative sex, but I don't want it to turn into sex, or I want it to only go so far. It's going to open up a whole nother safe space for people to stay connected intimately without it having to necessarily be sexual. Very
And it
important.
may slowly build desire.
And they slowly build desire and connection back. Absolutely. All right, next slide. So that's it. Again, validating it's normal to experience emotional distress, sexual problems, and sometimes trauma that can be triggered from previous trauma. So just being sensitive to those three things. sexuality will continue in the same direction. So if you came into family building challenges with intimacy, sexual problems already in place, and believe me, I've seen it all. I've seen people who haven't even consummated a marriage and they come in and they're like, we've never had sex, and so we're going straight to IVF. People who've had long-standing histories of painful sex, dyspareunia, vaginismus, erectile dysfunction problems since a man's been in his 20s. Like people will come in with problems. This is not going to help those problems. So it's so much better to get the education, get the sex therapy help, get the mental health help that you need now while you're going through this. Some people set it aside. Oh, we'll get to that later. Nope. Do it now. Do it while you're going through this because these are tools you're going to need to come out the other side without this being any kind of a long-standing problem. Thankfully, even with those numbers being so high, with how common it is for people to experience all these issues as they go through this sexually, most of it's transient, right? Most of it's going to go away. But you do want to pay attention to it, talk about it, get the help you need. And certainly if you had problems beforehand, this isn't going to make it better and they're not going to magically just, disappear when you have a child. So that's why sex therapists are here to help, and communication is key around any of these issues. I think that's all I've got, but I'm
Yeah,
happy to
I mean, I
open
think
this
just to
up.
sum it up is that,
Yeah.
the reason we invited Dr. Gross, we want you all to learn that if you're having issues with your sex life during infertility, it means one thing, it means you're normal.
Yep.
But we now have half an hour for Q&A, mostly hopefully for Dr. Grohl, because she knows far more about this than I do. Um, what questions do you have? If you feel comfortable raising your hand, raise your hand, or please post them in the Q&A box, and
Yeah,
Irina
and
will read them.
anything. Post them if you want to do it more
Yeah.
anonymously.
And
Like
I will just tell you this right now, nothing shocks us.
I was gonna say, I've heard everything. So
We've
you
heard
you will
everything. There's
not, you will not
nothing that will
surprise
shock
me.
us.
Yes. So this is
Irina may get shocked, but Liz and I won't.
yeah. Luckily, you're not gonna have to answer them, Irina.
Thank you very much, Dr. Grail. I learned a lot today, and it was a very informative discussion. So, I do have actually a question first question that came up. Can you please clarify about the STIs? Is this from the fertility clinic or what that is?
Oh no, no. I mean, I hope not. I've never heard of that happening.
Well, explain what an STI is,
Sexually
please.
transmitted infection or diseases, right? So this could just be something that was contracted. You could have a sexually transmitted infection without knowing you have one. You can be asymptomatic in some cases. And so you may not even have it detected until you come in for testing at the clinic. And all of a sudden you're like, what do you mean I have herpes? I never knew that. Or what do you mean I have vaginal warts or what, I mean, it can be a million things, right? And so it's really important to know that and treat it. And the clinics can help you get treated for that. And that, make sure that your partner's treated as well. So that's what that is, but not something that you're contracting at the clinic, something that may be discovered as part of the process of going through this. You may have never had a reason to get tested for it ever. And then all of a sudden you're tested as part of your medical treatment plan and you discover that you have something.
What you also see frequently in a clinic is that you had an infection many years ago. Like you may have gotten an infection in college or early
Yeah.
in your 20s, and it might have caused some tubal scarring or something like that. And so you may go through your infertility workup, and your physician might say to you, oh, you had a sexually transmitted disease in the past. You probably don't have the infection now,
Right.
but there might be some scarring as a result of the infection.
Yeah, really
That's
good point.
that's
I
very
actually
common.
I actually have a follow-up clarification on this question from the person who submitted that in the first place. It has happened to us from a fertility clinic.
Oh,
Wait, what is it? They caught a sexually treated disease in an infertility clinic? I'd
Mm.
be very shocked by that.
I've never heard that. That would
No,
be
I haven't
horrible,
either.
but
I
I've
mean,
never heard.
everything is sterilized, and
Yeah,
I think it might have been diagnosed at the infertility clinic, or there might have been some um, not 100% truthfulness between partners, perhaps.
right. I was going to say that's an unfortunate thing that can happen as part of the
Yes.
trauma. Yeah.
Yeah. I mean, unfortunately, STDs are often diagnosed. In fact, it's happened to friends of mine who are married or happily married, they thought, who, were diagnosed as having a sexually transmitted disease and realized that their partner had cheated on them and had brought the STD into their marriage.
Yep.
But I've never heard of someone contracting a STD in an
No, I
infertility
haven't
clinic.
either.
No.
Thank you. The next question is, and I'm not sure if it's from female or male partner, but I've lost my sex drive completely. Is there's something wrong with me?
No, not at all. I mean, again, and again, we don't know if this is a male or female person, but regardless, I always tell people to go get like their testosterone checked, whatever. I want to make sure that medically there's nothing wrong. So if you're really feeling a decline in sexual desire where you had a bunch before and suddenly you're not feeling like yourself, definitely go see a urologist and get your numbers checked. I mean, you want to make sure that there's nothing else going on physiologically in your body, and that's really important. But no, if it's part of the fertility process, losing desire is one of the number one things that both people in a relationship will talk about. Or if you're not in a relationship, if you're like a single person doing this, or if you're freezing your eggs, like, no one is feeling an abundance of desire when they're injecting themselves with medications and going into a clinic for, ultrasounds every morning.
It's not really a sexy process.
No.
Thank
It's
you.
also, a lot of women as they go through infertility treatment, it's a real challenge to their self-esteem and to their sense of being a woman and the sense of being sexy, because sometimes, they will gain weight from the hormones they're injecting. And so they stop feeling as sexy. And so, there's some, what sound like stupid things, but, I tell my patients, go buy some really sexy underwear or, but bras and panties, because there actually was a research study that showed that when women wear really sexy underwear, they feel sexier.
Yeah, and probably not during a cycle and giving yourself permission. You're being poked and prodded, and you, like Ali said, like you're bloated and you may have welts from progesterone shot. I mean, you're just not, you don't want to be touched, and that's okay. And I think a lot of people don't want to give themselves permission. Number one, they're scared that it's going to be this way forever and they're never going to have desire again. And number two, they feel guilty shutting everything down for a period of time and saying, look, I just don't want to be touched. Like I'll hold your hand, I'll play footsies with you under the blanket while we watch a movie, but I don't want anything else touched right now. And that's fine. That's where that communication comes in.
Thank you. The next question is, my partner feels less masculine because of the sperm issues. How can I support him better?
Oh, it's so tough. Yeah. If there's a male factor issue, very, very tough on men. Men and women go through very different feelings around this. I think women often have more people they can talk to. Men are not going to be sitting around the locker room gym talking about shooting blanks or having problems with their sperm quality or their count or their morphology. And so men often feel a tremendous sense of shame. The other problem is if there's male factor stuff going on, somehow with men, the male factor is very much tied to sexuality in a way that it's not for women. For women, it can be about femininity and, of course, their relationship to their bodies. But for men, it goes right to potency, right to like sterility, right to, I'm less of a man because I can't impregnate my girlfriend or my wife or my partner. And so it is a little bit of a different process. And if it's not male factor, it can be just as emasculating. Like I said, leaving samples, often women are not understanding enough about how devastating that is for a man and how emasculating it is to have to go into a strange place and leave a, sample in a cup. They often don't have the right stimulating material that they need to watch to be able to get turned on. Their partners aren't in the room with them, and they somehow are just supposed to like perform on demand when they can like they know five other people are in the waiting room, waiting for them to come out. So understanding, empathy, talking about it, saying, hey, this is hard on both of us. We're both experiencing different things as we go through this. We can talk about it together. This is not an easy time for us as a couple or as individuals. Come see one of us and our colleagues. This is all we do every day.
Thank you,
And
Dr. Mhm.
Arena, and I know for those of you who were on the webinar last month where we had Dr. Bill Peacock talking about male factor infertility, we're working and hoping to have done in a couple months a new video and interview with one of our patients who had male factor infertility, and he is very open about his thoughts and feelings. And so we're going to be, all hanging out in Texas and recording interviews with him
That's
just so other
great.
men can hear, not from Liz or me say, oh, this is normal, these are normal feelings, but hear from a guy who went through it himself.
Yeah, that's great.
Dr. Grail, any advice that you can offer to patient about the intimacy where donor eggs or donor sperms are involved?
I mean, I think it's the same. I think it's a deeper layer and level maybe of loss and grief that people may have to reconcile and experience, a deeper maybe level of failure, a sense of failure. Um, it's a little bit different for men and women. Sometimes if a man, if they're using donor sperm, a man's connection sometimes happens later, and sometimes there's a real difficulty with the man feeling a sense of connection to the pregnancy sometimes. So how can they start to connect earlier than when the child is born? With a woman, she can still connect to carrying a child unless they're doing surrogacy and, donor egg. So sometimes that lack of a genetic connection can be kind of sidestepped a little bit with that sense of biological connection of carrying a child. But I think in terms of the sexual stuff, I mean, for the most part, people get to donor egg and donor sperm after a long journey, unless, of course, they're coming in with a prior diagnosis of cancer or another medical condition and they know they're going straight to that. And so I think they've already, the sexual intimacy has already been sort of damaged along the way and challenged along the way before they get to donor egg, donor sperm. I don't know, Allie, what do you think? Is there anything else in particular about that third party?
Yeah, it's interesting because I was literally at our clinic in Tampa yesterday, and we were talking about couples really struggling to move on to donor egg and donor sperm, and yet also hesitating to see a therapist because they didn't really want to talk about it. And I'm like, it's no one's first choice
Right.
to move on. And in fact, I remember a couple of mine said this to me. It's not your first choice to move on to donor egg and donor sperm, but it's not second best,
Mm-hmm.
which I really liked. And I think they've
Yeah.
used that a lot as they've talked about their own journey. But I think it can, I think especially for men, affect their sexuality. I mean, the data, and again, I'm the nerd here, it's like, Beauty and the Beast here. Um, the data shows that in couples where they had to use donor sperm, the men have really good and healthy relationships with their children. And I think
Mm-hmm.
one of the reasons is they don't project their own talents on their child. They let their child bloom as that child is meant to bloom without dad saying you have to play football, something like that.
There is a question after the fertility treatment if couple would even ever be able to enjoy sex again. What if it's never going to come back, the desire?
Well, again, desire doesn't come back spontaneously. Oftentimes, that's a myth, right? And so, people, even without the reproductive history and challenges, often come to see me for sex therapy separate, completely separate from infertility. And they're dealing with similar issues, right? They've been married a long time, their desire is gone, they may not find themselves or each other as attractive as they used to. Things aren't, life is stressful, jobs are stressful, parents are aging, and so our desire isn't kind of what it used to be. We just don't feel like ever having sex again. And so infertility can be piled on to all those other stressors, right? And we have a history of infertility, and it took us 5 years to build our family. And so, yes, of course you can get it back. It's absolutely doable. I think it's very difficult to try on your own. I think help with suggestions and strategies and getting underneath what the issues are can absolutely unpack that and help people connect again.
Thank you. I have a
And by the way,
few.
can I just add that Liz mentioned this? Both of us have seen patients that were referred to infertility clinics because they weren't able to get pregnant. And it turned out they had never had intercourse.
Yeah.
And, there are physical reasons for that, there are cultural reasons for that, there are personal reasons for that. But, that's something one has to get actively and aggressively treated for, because then hopefully they can get pregnant through sex if they can get to the point of having sex. Otherwise, they can choose to have infertility treatment and bypass sex.
Yep. And I
Thank
bet people whose sex lives become better after all this. Because if
Mhm.
they're willing to talk about it for the first time and actually start to explore things they never thought to explore before or gave themselves permission to, or, it can open up this total portal to this whole new world of, sexual connection and play and spontaneity that never even existed prior to that.
you. The next question we have, I have endometriosis and a lot of position hurt. What should I
Yeah.
do?
Yeah, I mean, again, there are some realities that you have to really validate and pay attention, and that is definitely one of them. So endometriosis can cause painful sex, as can many other conditions. So again, different positions, different touch, playing around with not having penetrative sex. Again, Allie said some people separate it. They're like, look, we're gonna go to the clinic to get pregnant because sex is too painful for me when I'm ovulating. It's like the worst time for me to be having sex because everything, my endometriosis is the worst it's ever been during that time of the month. So there are lots of different ways to split these things apart if necessary. And people can explore amazing sexual connection without penetration or with different positions, as this person has mentioned. But, I treat people after they've had a prostatectomy after cancer and they can't get erections anymore. And people are like, oh my God, what our sex life is over. And it's just not. So a lot of this is just reframing what sex is and what intimacy is and what connection is and redefining it.
Thank you. The next question is, do you have any suggestions for getting connected with a sex therapist, specifically someone equipped to address infertility factors? What would you look for, and is there diabetes referral list, etc.?
Yeah,
Oh,
there's lots
there's
of
a database. I'm sorry.
Yeah, there's a lots of places you can look at. You can look at STAR, SSTAR. These are the sexual health organizations, like in the academic spaces. ASECT, AASECT. Um, SMSNA is for the urological people for male factor stuff. And then ISHWISH is a female sexual. And there's a ton, but these are the ones that are coming to mind. And they all have databases of people who are trained in sex therapy and who are certified in sex therapy. And you can see what their training is. And they're in by geography. I mean, you can go on ASRM too. The American Society for Reproductive Medicine may have that as well. Finding someone who specializes specifically in infertility and sexual health may be more difficult. Um, and you may need to kind of like branch out and see an infertility counselor for those issues, and then maybe a sex therapist for the specific sexual issues if you can't find the overlap.
Thank you.
Yeah, but there is a thing now called PsychPack. And so for psychologists, if they are licensed in, I think, one of 40 states, they're licensed in 40 states. And
Right.
so even if you live in Texas, for example, or Florida, and the person you like happens to be, I don't know, Wisconsin. I don't know the states because Massachusetts isn't one of them. You can do remote therapy with a certified sex therapist who isn't in your geographical area.
Definitely, definitely. And I will say that sex therapy traditionally can be very short term. I mean, not all the time, depending on how complicated the issues are, but it's not one of these things where you're like, oh my God, I'm going to be like laying on someone's couch doing therapy for the next 25 years of my life, unpacking what my mother did to me when I was younger. Right? It's not that. Right. So I don't want people to get scared away from it. Sex therapy can be very based on like behavioral treatment for the actual issue. If you are having vaginismus, if you're having erectile dysfunction, if you're having premature ejaculation, people will could go in there and you can maybe do 6 sessions around that or less to cure it. So, you could be talking to an infertility counselor for the general stuff and then like a sex therapist for 3 sessions to kind of cure what's going on sexually.
Excellent. Thank you. The next question, outside of endometriosis, is it normal for women to have painful ovulation?
Painful ovulation, I mean, it can, right, Allie, can
It
be
can, yeah.
related
I
to a
mean,
lot of
yeah,
medical things.
yeah, there are a lot of medical things that can cause painful ovulation, but I think if you're having significant pain every time you ovulate, you should tell your gynecologist or your reproductive endocrinologist. I mean, years ago they used to call it Mittelschmerz, which is a German expression for when the egg was released from the follicle. Some women could feel it, but it shouldn't cause severe pain. And you probably want to be worked up to make sure you don't have adhesions or endo or anything like that. I mean, nobody wants you to be in pain. And
Right.
people, you know, we want you, as you're going through infertility, as much as you can, to have a sex life that brings you joy and pleasure.
Thank you. We have one more question. I feel that my husband and I are not having enough sex to become pregnant. I have confirmed ovulation and feel bad telling my husband I'm ovulating because he looks too tired or I can't tell he's not in the mood. How do I address this?
Hmm.
You don't
Well,
have
I
to
mean,
have sex very often. Sorry, you don't have to have sex very often to get pregnant.
right.
A couple times a week because sperm can live in the female reproductive tract for days. And so if you're ovulating on day 14 and you have sex on day 10, you can still get pregnant.
I mean, I would get worked up, right? I mean, I think Allie would agree in any of these circumstances, like I talked about with the low testosterone levels too. Like, you should always get checked out medically first. I mean,
Yeah.
I don't think that you should just assume it's like a psychological thing that's happening, whether you're having painful ovulation or low desire or painful sex. You should always get worked up medically first. And then after that, I mean, then it's more nuanced, right? That's where the therapy would come into play. Like, okay, why is your husband so exhausted? Are there different times of the day that you can be doing this? Maybe you have morning sex before everyone comes home tired at the end of the day. Maybe it's on the weekends. Maybe he comes home during a lunch hour and you get, if you can afford it, you do a hotel room at lunchtime to spice things up. There's so many things people can do to get creative, to infuse desire and energy, to make something more fun, to not have it be at the end of a long day when people are tired and you're like trying to see if you're ovulating and your partner's exhausted and you're trying to convince him. And that's not a good feeling for anybody. And that's where that avoidance comes in. I mean, he may be saying he's exhausted because he's avoiding it because maybe he's living in terror and fear that he's not going to be able to ejaculate or get an erection. Like, we don't know until we start having these conversations with people what's really going on.
Thank you. Is there any help or solutions for women with antibodies based on negative rhesus factor? The level of emotional stress is
I'm sorry,
deeper.
can you repeat it again? Is there any for antibodies?
Antibodies, yeah,
Like
antibodies.
anti-sperm antibodies?
Based on negative rhesus factor. The level of emotional stress is deeper when you do everything, sex, IVF, you conceive, you still end up with miscarriage based on antibodies.
I
I
think
mean, I
that's,
would defer that right to the REI, but
yeah,
Allie,
me
take a
too.
stab at that.
I'm shaking my head like this is not a question for psychologists because I've never heard that stress of infertility could cause anti-sperm antibodies. I think this is a purely physiological medical question to be directed to your physician. I'm sorry.
Yeah,
We
I
just can't
agree.
answer that. Even if we knew the answer, we couldn't answer that.
Thank you. The next question is, I feel like I've seen this question quite often to come up in the different conversations and even in the forums. Is there any suggestions for, the positions when it's comes to a
For
time
pregnancy.
intercourse? Exactly. Some people saying, you should be on top, and some people saying, raise your legs, and I
Nope.
see
You
it
should be
all over
swinging
and
from the
over in
you
the
should be
comments.
swinging from the chandelier.
Nope. I would add that to the list of myths. No, I
Okay.
mean, look, people are trying to control every aspect of this that they can, and I totally have sympathy and empathy for that. I don't think this is one of them. Unfortunately, if it were that easy, it would be putting our clinics out of business. I think, like when you have a good egg and you have a good sperm and you have a solid normal embryo and it's placed in at the right time, you have a pretty good chance of implantation taking place, and your doctor will tell you based on your age what your statistics are for that. I don't think it's going to matter whether, you laid in bed for 3 days after sex and they used to say this too after transfer, like, don't move, don't even go to the bathroom, lay
For two
still in
weeks.
bed.
Women used to be hospitalized. They would
Yeah,
have the embryo transfer and they would lie in a hospital bed for 2 weeks and they had to use bedpans those whole 2 weeks.
right. And now I think they're like, yeah, don't go run a marathon,
Yeah.
but like,
Just
yes, you can
hop up,
travel if
hop
you
off
need
the
to. And
table, go home.
yeah, yeah. So unfortunately, I wish it were that easy, but I don't think there's a position or the length of time to lay still afterwards that is going to help this situation.
And unfortunately, the same could be said for McDonald's French fries. Although I'm never going to say that because people really enjoy eating McDonald's French fries. And so if you believe that McDonald's French fries are going to help you keep on eating them.
Right. Right. If you think that lying still or having sex on top or keeping your legs up in the air is going to help.
Yep,
I mean,
do
I
it.
think Allie and I would say if it
Do
doesn't
it.
hurt you physically or psychologically and it makes you feel like you're doing something that's going to work, then go for it.
Yep. Same thing with eating pineapple or wearing clothes with pineapples on them or wearing pineapple earrings. If you believe it's going to help, placebo effect is very strong.
Yes,
And in my world, anything you can do to reduce your stress level is a good thing.
100%.
Thank you. There's a question, can focusing on pleasure actually help us emotionally?
Oh, yeah, definitely. I mean, we say that sexual dysfunction is about friction and fantasy, right? That it's really that simple. So what it boils down to is you need the right amount of friction to be able to become aroused, to be able to maintain an erection and to lubricate as a woman, and to be able to, reach orgasm and have the blood flow go into the right places, right? So you have to know how to touch yourself or your partner in the ways that feel good and lead to the right amount of blood flow and arousal to get things functioning, right? That's one part. Second part is fantasy. And fantasy is what's going on in your head. If you're not focused on pleasure, and you're not focused on touch and sensation, sight, sound, touch, smell, taste. If you're not like even listening to music in the background and focused on something that's pleasant and pleasurable for you, nothing's going to work. These two things are not going to come together, which is why you have so many problems as people go through infertility, right? Because you could have all the right amount of stimulation and you may know how to touch your partner perfectly, but if in his mind he's thinking, oh my God, I'm never going to be able to get an erection, she's going to scream at me again tonight, she's going to lay in bed crying all night and be so upset it's going to be all my fault, he's not going to get an erection. Doesn't matter how the stimulation's going. So those are the two things you need. So if you focus on pleasure and you focus on sensuality and sexy thoughts and senses that create joy and pleasure, yes, it will absolutely help.
Thank you. I do not see any other questions coming up, but we'll give maybe a minute or so for everyone who is attending live.
Yeah, these are great questions. I'm so glad people are writing in.
So
Yes.
Liz, let me ask you a question. For your average, garden variety couple trying to get pregnant through infertility, what is like one top tip for enhancing their sex life?
If they're trying on their own or they're in the clinic or both.
I'd say both. No,
I,
I'd say no. Let me rephrase that. A couple who's doing treatment at the clinic and has found their sex life at home has sort of fizzled. What's the one thing you like the most to recommend?
I mean, it's almost easier once they're at the clinic. Well, easier and more difficult. The more difficult thing is you have that like doctor in the bedroom phenomenon and that sterile environment, and there's like nothing intimate. I don't care how great your clinics are, there's nothing intimate about a clinic, right? I mean, it's just not. So that can obviously interrupt any kind of sense of intimacy, sexuality, whatever. But once you can like divorce that from what's going on at home, it does set up the home base again as kind of a safe space where we can sort of explore touch again. And I would start with things like sensate focus, which is like kind of an erotic massage where you're not touching any of the genital areas, you're not touching anything for arousal, you're just simply touching your partner. How do you like this? Is this pressure good? Does this tickle? Does this not tickle? And then all of a sudden, your partner's gonna be like, oh my God, I didn't realize that it felt so good when my baby toe was massaged or my earlobe, right? And you get to this whole place of like exploration again. And like incrementally, you can work your way back up to more kind of sexual touch. So I think like start back at the basics and work your way forward. It's amazing what you'll discover about your own body and your partner's body and what comes up during those times. Like, am I distracted? Do I need music on? Do I need oils? Do I need a non-toxic candle that I can light? Do I need a diffuser going? Do I need to do this in a hot shower with my partner instead?
Not
So
too
many
hot.
things will come up. Yeah. Exactly. No hot baths. Um, so yeah, I think less is more. I think you start back at the basics. I think people set themselves up to failure when they just sort of try and jump back into bed and like, let's have sex. And there's been no discussion and no exploration and no like, what do I like? What do I not like kind of talk.
I remember years ago when I run mind body groups, we have this assignment when we're learning mindfulness is to do something mindful over the week. And then next week when the group reconvenes, describe what you did mindfully. And so someone would have taken a mindful walk and someone would have, taken a mindful shower. And one woman came in, I'll never forget it. And she turns bright red and she goes, I made love mindfully. And we were merciless. We're like, we want details.
Right.
So,
A
and she's
totally
like,
different experience.
you know what? It was like the first time. Like I
Yeah.
was so conscious of every time he touched me or I touched him where
Yeah.
and we are aware of the sounds in the room and everything. And she said it was a magical form of
Yeah.
lovemaking is to
Yeah.
be
You can just
mindful.
start with mindful practices
Mhm.
just to get the hang
Yeah.
of that. I tell people, go get a massage and like, where is your mind?
Yeah.
People are like, oh, what am I going to make for dinner? I forgot to pick that up at the grocery store. I wonder if my boss is going to be back for that email I need to send later. Am I, and like no one is thinking about their body being touched in the room during the massage. It defeats the entire purpose. And it's so difficult for people to be mindful these days. So yes, mindful sex is a thing. If you're interested in that, you can look up Lori Brotto, Brotto. She's written about it. She's the guru in the sex space around mindfulness and how to be mindful around sexuality. So it's a good one.
Thank you. Thank you once again for joining us today, for sharing your expertise, Dr. Grill. It's absolutely a pleasure to learning from you today, and you answer a lot of very insightful questions today as well. So once again, we appreciate your time and hope.
Always happy to be here. Thank you.
Thank you.
Thank you, Liz, so much.
Thanks. Great to see
Have a
you.
good evening, everybody.
Take
Thank you,
care.
Dr. Domar.
Bye.
Bye.
Goodbye.